Good morning and good afternoon, everyone watching us today. My name is Alexandra Kuzmanovic, and this is another weekly live Q&A with Dr. Mike Ryan and Dr. Maria Van Kerkhove, who are answering all your questions about COVID-19. We're all saddened by the news of a tragic event that has happened yesterday in Lebanon, in Beirut. Our thoughts and prayers are with all people affected. Dr. Mike and Dr. Maria, good morning, and maybe we can give some update how we are supporting people in Lebanon at the moment.
Yeah, and it's a very, very shocking event, and many of you will have seen those images on the television. And at this stage, there are over 100 people reported dead and thousands injured, and clearly many, many others in shock. And people have lost their homes, they've lost their livelihoods. And this comes at a particularly difficult time in Lebanon. It's been going through a big economic crisis, a political crisis, as well as COVID-19. And remember too that Lebanon has been instrumental in both supporting millions of refugees from Syria, and Lebanon is used as an operations base to support people in Syria as well. So this is a major incident. Our teams are on the ground. Our WHO country team is on the ground. We have logisticians there and others. And we've already begun dispatching trauma and surgical kits from our regional warehouse in Dubai. And thanks to the UAE Royal Air Wing is donating the transport of those kits to Lebanon. We also have some emergency medical teams on standby ready to deploy should the government of Lebanon request those, working closely with the IFRC and colleagues in the UK as well. Obviously the damage assessments need to continue, but as you've seen, many hospitals overwhelmed with casualties, and people are still looking for the injured and the dead. So it's a very sad day. We stand in solidarity with the people of Lebanon. And we will do everything in our power as WHO and the UN system to support them.
Thank you, Mike. I would like to invite our viewers to ask their questions as usual on Twitter. If you're watching us on Twitter, use the hashtag AskWHO. If you're watching us on LinkedIn, Facebook, or TikTok, then leave your question via comment section. There are some questions we, again, lacked time to respond last week, and the first one is if we can remind our viewers about the signs and symptoms of COVID, and do we have any new scientific updates on this?
So thanks, Alex, and hello everybody. Yes, I think it's always good to remind ourselves sort of what we're learning and what we know about the disease that is caused by SARS-CoV-2 infection, the disease we call COVID-19. Most people that develop disease develop a respiratory disease. So they often have a sore throat, they often have a cough, might be a dry cough, and many people develop fever. Those are the most common symptoms. People that progress to more severe disease have a shortness of breath, which means it's very difficult for them to get enough oxygen in. And if that happens, it's really important that people seek care, contact their healthcare provider immediately, because that indicates, the body going into distress. Things like sneezing aren't as common. I know many people think because it's a respiratory disease you have sneezing. We do know that some people they lose their sense of smell, they lose their sense of taste. But again, we're 7 months into a pandemic. Even though we've had more than 18 million cases, we are still learning about this. We have a typical presentation, which means most people will start with a respiratory signs and symptoms, but not all. So it's really important that everybody remains, ready for this and looks out for the signs. But the most common signs are fever, cough, sore throat, fatigue.
Thank you, Maria. Yesterday, we also hosted a meeting with scientists around the world, virtual one, I assume, on COVID-19 transmission. Are there any important outcomes and lessons from that meeting?
Yeah, thanks for mentioning that, Alex. So from the beginning of this pandemic, the two of the major things that we are concerned about are severity, which we just covered a little bit with the symptoms, and transmission. So how does this virus transmit? Who transmits, and where is transmission occurring? So these discussions, you mentioned we had a call yesterday, and we did. We had more than 700 groups from our working groups from the R&D Forum on clinical management, on virology, on infection prevention and control, on epidemiology. And we also opened it up to other disciplines like engineering and aerobiology, and others, social science as well, to really see what do we know? Where are we? There's a lot of discussion about how the virus transmits, whether it's the droplets or the aerosol or fomites, contaminated surfaces, or other modes of transmission. When a person transmits, because we know that people can transmit when they have symptoms, but also when they don't have symptoms. And most of the data that we've seen from the collection of samples from people who are positive, they seem to be or appear to be most infectious at or around the time they develop symptoms, which can include before they develop symptoms. So that means before they actually have any symptoms. But I think what's most important right now in this discussion is where transmission is happening. And it's a combination of the type of exposure that one may have. We know that people in close contact, you need close contact between people to have transmission. That's where most transmission is happening. The intensity of that transmission, if you have direct contact with someone, and the duration. So the longer you spend with an infected person, the higher the risk is of the chance of transmission. And really what we're trying to get at is have a multidisciplinary discussion about this. It's not just the epidemiology that's important. It's not just the ventilation that's important. It's not just the signs or symptoms that people have that's important. All of it, and where it's happening. And there's things that we can do to prevent that, which is why you hear us saying things like keep your physical distance, wear a mask when you can't do your physical distance, make sure you avoid crowded places. You try to prevent and reduce the exposure to that virus so you prevent the chance of yourself getting infected.
Thanks very much, Maria. Here we got a question. You mentioned wearing a mask, and Yoshihara from watching us on Facebook is asking, is there a correlation between the rate of corona infection and wearing a mask?
So what we've always recommended the use of a mask as part of this comprehension, one of the tools that we have in this fight against COVID-19. We recommend the use of masks for health workers who are dealing directly with patients. But in the general public, what we've recommended is the use of a mask for somebody who is sick, because it forms a barrier of a source control, which means you put this mask on, and we have recommendations on how to make a 3-layer mask, which includes a middle filtration layer, which prevents what's called source control. So if you're infected, and it prevents you from passing the virus to someone else, and that's really important. And if a fabric mask is worn, then it can prevent the spread.
Thank you very much, Maria. Here we are having a question from Hunter, also watching us on Facebook. How many cases are estimated to be unconfirmed, especially in developing countries? Is this virus having more significant effects in developing countries compared to what we are seeing in developed countries?
So that's a good question. I think one of the things that we know is that there are many unrecognized cases. And I think there's a number of reasons why cases are unrecognized. Some of them, it's due to our surveillance activities and where we are able to find cases, how hard we are looking, the systems that are in place, the testing capacity that is there. And some people don't have symptoms, so they may not present in a healthcare facility. What is really important for us to do to try to understand where this virus is to do what we call active case finding. Where we test for suspect cases. These are cases that fit a definition that says we think that they may have COVID-19. If we test those individuals and find cases, those cases should be isolated, and then we carry out something called contact tracing, which means we identify the close contacts of the individuals who are identified as a case, and we follow them over 14 days, and we quarantine them, which means we prevent them from coming in contact with other people. And this breaks chains of transmission. But I think all of us know, I think globally, that there is unrecognized cases that are out there. And I think that will vary by country.
Thank you, Maria. We've been talking a lot about young people and their role in the response and also in transmission. And some of our viewers were asking if we also refer to younger children. Just to clarify when we say young people and what are their roles in this.
Yeah, well, definition of younger people is certainly not me. No, when younger people, because at the beginning of obviously of this pandemic, we saw so many older people very, very ill. And there was a perception, and a reasonable perception out there, that this was a disease of older people or people with underlying conditions. And certainly, yes, there were reported cases in younger people, but it wasn't seen or absorbed as being a major part of the pandemic. But we've seen a significant proportion of all cases in this pandemic since the beginning, have been in younger people. But we're also seeing that shift into younger people. Older people have been very careful about protecting themselves and we've all been trying to be careful about exposing older people to the bug. But as younger people are moving back into society, then clearly younger people can act as a mode of transmission. What I mean by younger people are children under 10, teenagers, and young adults. Now, each of those groups is different. They have a different social environment, and they interact with each other in a different way. Younger adults may interact in crowds at parties, at festivals, in bars. Teenagers in the same way may interact at summer camps, interact in schools, interact in different kinds of group activities. And again, younger children are brought together for birthday parties, for different things. So each of those age groups have slightly different factors that may expose them to the virus. There is no question, I think I've said it before, that younger children do not seem to have a very severe course of illness, although some children do get very severely ill, especially those with underlying conditions, and we need to protect them. But we do know that all human beings play a part in transmission. And we think that teenagers and younger adults are equally able to transmit the virus than the adult population or older population, with some evidence that younger children may not participate in transmission as actively as older children and adults, but they do participate in that process. So creating environments in which younger people's activities can be safe and where we can reduce the risks, and I think that's, again, it's everybody's job. The authorities need to create the environments in which younger people can engage in safe behaviours, but equally younger people also have to take on board that they have a responsibility in this too. You can choose not to do things. Maria says this all the time. Ask yourself the question, do I really need to go to that party? Do I really need to be part of that indoor disco or indoor nightclub? Do I really need to be there? And what are the consequences for doing that? A lot of that risk to younger people are part of society. So really the overall risk to younger people is mainly due to the overall risk of the epidemic in a given community, and that's down to the level of community transmission. If transmission at the community level is very, very low, then the risk to everybody is very, very low. If community transmission is high, then everybody's at risk. Maybe at different risks in different situations, but everybody is at risk. So we need to work together to reduce those risks, and younger people have a huge opportunity to drive down transmission in this by their behaviours.
Thank you.
Can I just
Please.
quickly add something? Because one of the things we're trying to do right now is look really closely at some of the countries that have had success in suppressing transmission and that are opening up. And I think, unfortunately, right now what we're seeing in some of these clusters is that they're happening where younger adults or are gathering. And there is a consistent picture that we're seeing right now. This virus transmits in clusters. This virus likes people that come together, and it forms clusters and it forms outbreaks. The virus needs people to transmit. And so if we provide an opportunity for people to come together and the virus is in the community, as Mike has said, it will transmit. So it is things like social gatherings and bars and nightclubs. And we're seeing some increases in transmission among college-age students, among people that are either coming together for social events through different types of sporting matches, not even at the sporting match itself, but actually coming together to watch the sporting match. So we want people to get back to their lives. We want people to enjoy life again, but we do need people to still do physical distancing. It is really important that we don't give this virus an opportunity, and unfortunately we are seeing these clustering that is happening. So we need to prevent these clusters. Not everybody transmits the virus to somebody else. I think that's kind of something that we need to also share more widely, is that it's estimated that between 10 and 20% of all cases are responsible for about 80% of transmission events, which means that there's many dead ends. And so we have to stop these clusters from happening. And so we can do that by preventing some of these close gatherings and crowded spaces.
And I know, Alex, you want to move on to the next question, but I think there's another phenomenon that's emerged, and I think this is where, again, younger people can really help. No matter where you are, and we want pubs, the clubs, and everything else, the summer camps to open, and there are countries in which that can happen safely, but there's always a residual risk. In many countries, people are asked, for example, to leave their name and phone number when they visit a restaurant, visit a club, do whatever. And then if they are contacted, they're asked to get a test, or they're asked to provide details of their contacts. It's really important that not just at any time a cluster can happen. It's nobody's fault per se, and we need to avoid blaming. Yeah. Things happen. Yeah. Cluster happens. That's a problem. The second problem that occurs is when people don't want to give any details, they don't give, and we can't trace people, or where people refuse to be tested and say, no, I don't want to be tested. And that then creates another problem. So when something happens and there is a cluster or there is a problem in the community, then everybody needs to participate and get involved in finding the solution. And it's been difficult for some authorities. They've particularly contacted younger people who say, no, I don't want to be tested, I don't want to give you my details, no, I didn't have any contacts, because they don't want to embarrass their friends, and everyone starts to think about the consequences. Oh, you know, I've been exposed and now I'm positive, and now my friends are all going to know I'm positive and they're going to contact. And there is pressure, and we need to recognize that. It's not an easy thing. I wouldn't like, if I was positive, for all my friends to be called up to be asked where they were and what their exposure was. And that's tough, but it's what's needed to stop the virus. So it's really important that when we avoid the problems, but that when the problems happen, that we engage and we participate in solving the problem and not making the problem worse by ignoring it or avoiding the issue, because that is happening in many countries.
We're in this together.
We are in this together, and there are a lot of follow-up questions coming as you are talking. One is, when do you think we can have large sports crowds again, especially with no physical distancing?
Myself and John here really hope. We're both Leeds United fans, and they've just gone up to the Premier Division, and I would love to go to their first game, but I think we have to be very prudent. I mean, it's really tough to say we don't know, but the fact is, we don't know. Large crowds of 40, 50, 60,000 people is not just the risk of being in the stadium, it's the risk of going to the stadium, the public transport, the bars and the clubs. Imagine all the problems we have now with nightclubs and bars, and you squeeze all that together into a 4 or 5 hour experience where thousands of people go on the same public transport to a venue, get involved in the social aspects before a game, be involved in the game, and then all of the social aspects after. In the context of community transmission, that could be disastrous. Now, we have seen in countries like New Zealand have reopened venues, and they have brought crowds back, and they've done that safely. In places like Japan, for example, with their baseball, I think, and sumo, they have limited crowds, and they have a selection of fans coming, and everyone gets the golden ticket. And we may have to expect that as the thing opens up, that we go from having no one at the games to maybe having 1,000 people at the game to 2,000. And we're just going to have to accept that we move step by step by step. We all want sport back. We all want our festivals back. My daughters are particularly upset because the Palio Festival is cancelled here in Switzerland. And they fly over, they would love to fly from Ireland to be part of that. So, you know, everyone is impacted by this, and we all want to get back to our normal lives, but we're just going to have to be careful for a good bit longer. And I don't know, we really have to be honest with people. It's very unrealistic in countries with community transmission that we're going to be seeing large gatherings like that this year. It's really unrealistic at this point. There are certain circumstances in which things can happen in countries that have really got very good control, but right now it's hard to see those fully reopened venues.
What we're trying to do, Alex, is we're trying to help the people that are running these gatherings, these venues, to take the right types of decisions. Can this occur? Should it occur? And if it does, how can it be done safely, more safely? And there's different things that they need to consider. Is it an indoor event? Is it an outdoor event? Can physical distancing happen? Can we do it with a limited number of people? Can we do it virtually? You know, so we're trying to help the decision makers take a risk-based approach for every event. But I have to say, it's not only the football matches. This also should be considered for birthday parties. It should be considered for sleepovers. And I know even my little ones, you know, they want to go on sleepovers, but right now it might not be the best idea. So we need everyone to sort of be with us and be in this together to work through what our normal is going to look like going forward. But I agree, we have to be realistic and we have to set the expectations of everyone, because if everyone thinks that we're going to go back to the way it was next month, I think we're all going to be disappointed. So work with us, and I think young people can help us find solutions. So there's a lot of people that are trying to come up with ways of how we do things going forward. Help us be creative, and think of the ways that we can still see our favorite teams, perform. We can still have music types of festivals, but we do it safely. Because right now, we mentioned that people that get sick, not everybody gets very, very ill, but even if you're younger and you get infected, we're still learning about long-term effects. And even people who had mild disease or didn't have disease at all, we're finding that some of them are having some longer term effects. So we just really need to be careful. There's so much that we don't know yet, even though we're all trying to learn as much as we can, as quickly as we can.
Thank you, Maria. Mike, you mentioned at the beginning of this answer, which was very elaborative and I think very helpful for our viewers in particular, but we have a lot of parents of younger children watching us, and there was a question, if their kids have underlying conditions, are they still safe to go to school? And there were a lot of questions. Again, we did speak about it a few weeks ago, but they're also asking a lot again, is it safe for kids to go to school? Will it be safe to go again in September to school? So can we maybe give some responses to these?
Well, first of all, we all want our kids back in school. We're paying a heavy price, and our kids are paying a heavier price for their lack of access to education. And I think I've said in the previous Facebook Live, there are many countries in which school is a safe and secure environment for kids, both for accessing food and avoiding exploitation and abuse. The schools are not just about education in our world today, unfortunately. So we all want our kids back at school. But the reality is that unless the disease is controlled at community, I'm not saying absent, but unless we have control over the virus and we're suppressing the virus, then opening schools in the context of fully blown community transmission is likely to make the problem worse, not better. Because what we don't want is to open the schools, then close the schools, then open the schools, then close the schools. And there needs to be not only low levels of disease at community level, then there needs to be risk management measures in place to reduce the risk to kids in the school environment, and then plans in place to react if there is a case. And we've seen this before. We had this argument going back into March and April when we were talking about reacting to clusters and being able to do cluster investigations and being able to do contact tracing and do testing. And even now, months and months on, some countries are struggling with those basic public health measures, and now we're going to go back into schools, which is going to make more demands on the surveillance system, more demands on the response system, and at some level we may have to, in some communities, decide, do we want the schools or do we want the bars? Because opening bars and nightclubs and then opening schools and doing it all together may result in unintended consequences. But with regard to specific children, many parents out there have children with underlying conditions, and I know that they worry every day about their kids, because kids are exposed to all kinds of different things in a school environment, and it is tough. And we want to make sure that we integrate all children into the education environment, and we don't want to exclude. And we've spent decades now, many great initiatives around the world that are trying to really educate together, bring kids from all backgrounds with all conditions together as much as possible in a school environment that respects diversity, that brings everybody together and makes the necessary arrangements for those kids who may struggle or may have underlying conditions. So that's positive. But in the context of community transmission, again, individual parents will have to make their own decisions, and also speak to the school to ensure that the school has special arrangements in place for those children with underlying conditions who may need extra protection or extra shielding, in order to make their school experience safe. And we can't advise from here on each and every school. So much depends on the resources the school has, the size of the school, the space that the school has, the level of community transmission, the amount of extra funding and teachers the school has. Because if you start to decompress the classroom and go from 40 kids to 20, now you're going to need 2 teachers, not 1. So this requires not just changing what we do, but we have to invest in order to be able to change. So I would advise all parents out there who have children with underlying conditions in any country that's planning to open schools, they should be, as they would normally do, I think, be contacting the school heads and contacting the support teachers to see what arrangements are going to be put in place in order to reduce the risk for their kids. And, you know, in the end of the day, this is parental choice. A parent have, you know, it's a tough decision. Because parents have to make a livelihood too, and I know it breaks their hearts to sometimes have to have kids in school when maybe they feel they should be with them more, but this is one of the awful facts of life. But in that regard, I just think they're going to have to both ask the school and then maybe make demands from the school as to what needs to be put in place in order for their child to be as safe as possible.
There's a lot of good discussions, I think, that are happening, you know, to consider all of these things and listening to parents and listening to the kids themselves. Again, some of the kids are having some really good ideas about how this could be done. But I think in this discussion, we have to constantly remind ourselves that schools are not isolated locations. They're within communities. So, you know, you can't have the discussion about a school without discussing what is happening in the community. As Mike has said, if you have transmission that's in the community, that transmission will move into the school. It's not just kids that are at the school, there's adults that work at the school, not just teachers, but the nurses, the staff. And everybody wants schools open, we all know that. But we have to do that in a way that's safely. And there are very good discussions that are having very serious discussions, you know, about how to do this safely. As we want to open up all of these other locations, schools are one of those, and we have a technical advisory group that we've brought together to help us look at educational institutions, because not all schools are the same across the world. I think your viewers know we work with all countries, we work with everyone everywhere, and schools don't look the same all over the world. Schools for very young children may be different from secondary school. They're quite different from universities and colleges, and there's indoor, there's outdoor. So we're doing what we can, and as Mike said, we can't give a prescription, you know, about how to do this everywhere. What we can do is lay out the considerations that need to be taken into account in the context of the community while trying to get kids back into school.
Yeah, and maybe a quick shout out to our colleagues in UNESCO and
Yes.
at UNICEF.
Yes.
Because
yes.
they've been doing a lot of the heavy lift on this
Yes.
and supporting schools. So we're there to give technical advice, but those agencies do a tremendous amount of work at
Yes.
country level to support school systems.
Thank you, Mike. We are also receiving a lot of questions around masks. The one is coming from Alexandra from watching us on Facebook. Why health people are required to wear masks if we are saying that masks are for sick people?
So there's different ways masks can be used, and masks are a tool in our toolkit. You know, you've probably heard our Director General say, you know, not masks alone, not physical distancing alone, not hand washing alone, do it all. And I think we need to kind of promote this as much as we can. Do it all. Do everything that you can to prevent yourself from getting infected. What we recommend for the general public, so we're not talking about healthcare facilities, but for the general public, to wear a fabric mask. So these are the non-medical or non-surgical masks that you see healthcare workers using. Use a fabric mask when you're in an area where there's virus, where it's circulating around, and you can't do physical distancing. This is a layer of, another tool that in case you're infected and you don't know it yet, or you don't have symptoms, you prevent yourself from passing the virus to somebody else. So again, it's another tool that we can use. And it is important, if you live in an area where you are asked to wear a mask, please do so. Please follow your national guidance and wear a mask. This is part of the solidarity, you know, of being part of the fight with it. Follow those guidelines, as well as if you're asked to stay home, stay home. Please do physical distancing. Please clean your hands regularly with soap and water or an alcohol-based rub. Practice what we call respiratory etiquette, which is coughing and sneezing into your elbow, and be informed. So one of the things we may not always say is every day you should be informed about where this virus is, where you live, where you work, where you want to go, and get your information from good sources. But masks are one of the tools that we have.
Thank you, Maria. And also, just to clarify, people ask every time, why are we not wearing masks now? Because we are in indoor space, but we are sitting more than 1 meter apart from each other. So as you mentioned, if we can't physically distancing, then we should wear a mask.
Yes, but we also have within the building that we work in, we have strict limits on how many people can come in. So not everybody is actually back at work here in WHO in our headquarters, and we have good ventilation. We're very lucky to have that here, and we practice physical distancing. So even us, we wash our hands regularly. We are constantly reminding ourselves not to huddle together, not to come close together, because sometimes people forget, but we make sure, and even they can't see on the floor, but we actually have markings on the floors to keep ourselves distanced when we walk down the hall, when we go into the cafeteria and get food, and even where our chairs are on the floor right now, to remind us, how far at least 1 meter is.
We're sitting in little yellow boxes here.
Yeah. And it may look different with the angles of how far we are from one another, but we do follow our advice. We do follow the advice we give you
A very simple example is we've got 7 floors here, and there are 2 corridors down each floor. So now you can only walk up one corridor and down the other. So everyone flows in the same direction. People aren't crossing each other in the corridors.
with arrows on the floor.
When you press the button for the lift, you stand back behind another yellow line to allow anyone else to come out of the lift, so you won't be standing at the door. Our lifts have, for the most part, are 1 person per lift, and some the bigger ones have 2 persons per lift. So, and each one of those things is not perfect, but what it illustrates is what you try to do is reduce your risk at every possible opportunity. And in doing that, you create an overall low-risk environment. No one thing you do is reducing the risk absolutely. You're adding together a number of different behaviors and different rules that allow us all to remain safe in the environment. I mean, we have, I would say, 2/3 of our staff working from home, and I mean from March, and again, strict limits. If you want to come to the office, you can't just walk in. Even as a staff member, you have to be registered to come and work at the office. So the team are constantly managing how many people are in the building and all of that. So we are taking a lot of measures to try and keep ourselves and everybody else safe.
Thank you. There are follow-up questions from teachers now who are watching us. Do we have any recommendations for teachers how to stay safe, especially if they are pregnant? Is it still safe for them to work, or they should stay at home?
So there's a lot of things I think everyone can do, whether you're a teacher or not. And so part of it is about, trying to minimize your risk of exposure where you work and outside of where you work. So in many areas, I mean, I come from a family of teachers, retired teachers, but teachers who loved their work and loved, being in front of children and doing that. I think making sure that when you're outside of the classroom, that you're wearing your mask where you go do your shopping or you go do other things. And I think that there will be things in schools that will try to minimize the risk. I know at my own son's school here, they had some recommendations for the teachers. The teachers had to wear a mask. The children, they had a limited number of children in the room, and they had physical distancing there. And so it will depend on the location and where those schools are, how the school is set up. And if any of the teachers have an underlying condition, if they're pregnant or whatever, talk to your doctor. Have a conversation with your medical provider and find out what is right for you. Again, it's very difficult for us to give individual advice, and I think we shy away from that because the context is very important. And especially at an individual level, your level of risk may be different based on who you are, your age, the underlying conditions, etc. Yeah.
Thank you very much, Maria. We received.
Just add to this on teachers, because we've all of us have had magical teachers in our lives, and everybody who's listening, even if you don't like school, and even if you don't like half your teachers, there's always 1 or 2 teachers who shape your life. And as W.B. Yeats, a famous poet from my home country, once said that education is not filling a pot, it's lighting a fire. And for those teachers out there who continue to light those fires of curiosity and learning in people, we thank you from the bottom of our hearts. Because sometimes we talk about the heroes of the healthcare system, and they are, but our teachers are our heroes too. and they are in the front line in this sense. They know how important education is. They want to get back to school like everybody else, but they also want that to be managed in a way that the risk to their kids, the risk to themselves, and the risk to their families are minimised. Everything should be done to maintain the lowest possible risk. And again, it is the responsibility of government and communities to push down infection, suppress infection in the community to the lowest level, and then we can bring our schools back online with the appropriate risk management measures. And teachers are hugely well placed to be a big part of making that a successful endeavour. We need our teachers. We need our teachers back in school. We need our kids back in school, but we need to do that safely. But teachers are our heroes too.
Thank you very much, both. We are running out of time, and the day is going to be long. So, but just before we close, last one is how previous pandemics were ended, and someone is asking, and can we take any lessons to stop this virus from spreading from previous experiences?
Ooh, Alex, that's a fantastic question from whoever that came from, and that's quite a long discussion, I think. I think, we've heard over the last day or two people feeling a bit of despair, people feeling a bit fatigued by all of this, and this is a lot to handle for everyone, no matter what age you are, no matter where you live. There's so much that we can do there is hope, and there's so much that we can do to drive down transmission, and each of us has a role to play in this. I think we've said this many times before. We want everyone on the planet to understand that they have a role to play in this. They have a role to play in preventing themselves from getting infected, and there's things that you can do. There's the physical distancing that you can do, washing your hands, practicing respiratory etiquette, following national guidelines, being involved, engaged, empowered, sharing good information, being kind to one another, help each other out, looking after one another. There are things that communities can do. There are things governments can do. There are things all of us can do, even teachers, And I think even just mentioning teachers, every parent has even though we appreciated teachers before, have a much deeper appreciation of what teachers do for all of our children every day. But I think we need everyone to understand that this is going to take some time, but there is hope and we can turn it around. There are some countries that are going through something very difficult right now, my own home country included, but they can turn it around and they will turn it around. So we may get to a point where we have to learn to live with this virus and figure out a way to keep transmission suppressed while we get economies and governments going. And that may happen with this virus. Getting rid of this virus completely, I think, will be incredibly difficult. And I think what our goal is to really drive down transmission to the lowest level possible, preventing infections, certainly preventing deaths, but getting people back to normal. And we're working out how to do that.
Thank you.
Yeah, and we've, most of us, in fact, almost all of us, have only one experience of a pandemic, and that was the 2009 pandemic, which is in recent living memory. And again, important to note that the seasonal strain we have now going around for flu are the remnants of that pandemic in 2009. Right. So the vibrations of a pandemic can stay for a very, very long time, but at a lower level. And as this COVID-19 or SARS-CoV virus spreads amongst people, it will continue to create infections until it burns out, or until we burn it out. We have two ways of doing that, as Maria said. We suppress the infection. That's tough because it takes a sustained effort, and we see the impact that's having on people and economies and psychology and schools and teachers. There's a big price to pay for being able to do that, but the price of not doing it is heavier. But then we have the prospect of vaccines coming, and vaccines could play a very important part in eliminating or providing long-term control over this virus. But we need to match, as Maria said, what we do in terms of suppressing the virus and what science can bring in terms of vaccines later. It'll be all the easier to contain this disease if we've already done some of the work. And again, when we look at the seroprevalence data, in other words, the number of people in the world who currently have antibodies that show they had a previous infection, it's relatively low. In most cases, under 10%.
That's right.
And that means that, on a planetary basis, 90% of people on the planet are still susceptible to infection to this virus. So this virus has a long way to burn, and we have a lot of work to do together to suppress it. We're accelerating and working really well and getting some very good results on vaccine development, but there's a lot to do, and we need to bring that to the game. But the history of pandemics is they take time, and they take time to control, and one can never predict when they will end. But certainly bringing a safe and effective vaccine online that we can distribute to everybody in the world would be a huge step forward in that. But in the meantime, we have to use the tools we have. And as Dr. Tedros says, don't do one thing, do it all.
Thank you very much, both, for your time. Next Wednesday is Youth Day, so we hope that we'll have more youth watching us and asking their questions. Thank you everyone watching us today from UAE, Turkey, USA, very early, Namibia, Luxembourg, Iran, India, Nigeria, Bangladesh, Zambia, Indonesia, Pakistan, Poland, France, Lebanon, Italy, Kenya, South Africa, Belgium, Spain, Morocco, New Zealand, UK, Jordan, and many others. Please do it all as Dr. Mike Ryan, Dr. Maria Van Kerkhove, and our Director General say, and stay safe.